When I was a teenager, my own grandmother, Eileen, got Alzheimer's. With Alzheimer's, you're dealing with between 30 and 200 root causes. For each case, he's able to reverse Alzheimer's.
Prepare for the worst, but expect the best. Be optimistic, but be prepared for something bad.
Yeah, there is hope.
Welcome back, everyone, to the Molding You podcast. This is episode 11, and I'm joined by Dr. Joshua Helman. Thank you for being here with me.
Great to meet you in person. This is amazing.
Yeah, I've seen you only online as an influencer, but now nice to be in person.
Likewise.
But you have such a fascinating background and story, and I know the concept of Alzheimer's and memory loss is so important to so many people, and a lot of people don't know yet that it's important because they haven't come to that bridge. But I've personally dealt with it in family and close friends, and it's a horrible thing.
Agreed.
What got you into Alzheimer's? Was that like your passion always?
Yeah, actually, when I was a teenager, my own grandmother, Eileen, got Alzheimer's. And I saw not only how it affected her personally, but my parents' generation, because they're thinking, wait, this is Grandma Eileen today. What is going to happen to us in 20 or 30 years? And, you know, as a teenager, I was tuned into those things. And I was also a nerd. I was like, you know what? I'm just going to study really hard. So I was literally studying biochemistry as a teenager. And the cool thing is the things that I learned when I was 17, I'm using them today. Just the basic biochemical pathways haven't changed.
Yeah, it's always sad to hear a personal story about Alzheimer's, but interesting how a tragedy kind of turns into a passion for helping others. I know you said when you were 17, you went straight to Harvard. Was that the...
It was. I was, and I shared with you briefly, I was trying to get away from my parents in Los Angeles. I was like, where's a good school really far away from Southern California? Harvard. So everyone in my high school wanted to go to Stanford. I was like, let's check out Harvard.
Yeah. And was it difficult to get into Harvard, or did you have like an outstanding...
I think what got me into Harvard was I had outstanding test scores, and I had the proof that I was a nerd. I did a summer science camp type thing in astronomy, and yeah, and lots of AP classes.
Mm-hmm.
So I think that's what ended up getting me in.
And did you go early? Like 17, is that young to go, or is that just... I mean, that's the typical...
I was born in November, so
Gotcha.
I think that's what happened.
So you had a head start.
Yeah.
That's awesome. And then, so undergrad at Harvard and then MIT.
Correct. So actually I took a year off between undergrad and medical school. I went to a Harvard MIT program called HST, Health Science and Technology, and I would credit that with much of my mindset in terms of solving problems. And what I love is so many people, part of that program, from instructors to other students, were like me, kind of a sponge that wanted to, in order to fix problems, not limit to any one silo. And so between undergrad and med school, I got a master's degree in England in biochemistry. And that was also an eye-opener going to school in year for in England,
Mm-hmm.
just seeing a completely different worldview and approach. But again, I think it was the mindset I got at the Harvard MIT med school program where, it doesn't matter if this is in the internal medicine department or the surgery department or the pathology department, or frankly, something non-medical. The most important thing is to fix the problem.
And I like how you talk about mindset, because I feel like, I mean, there's a lot of doctors, right? But they're not all successful. I mean, you have many clinics, you have the social media. So what kind of mindset, a lot of people kind of drop out of the race. What keeps you in that?
Yeah, it's interesting. You're right. I'm playing the long game, literally.
Mm-hmm.
And, I'm reflecting back now on the mindset, but, I remember doing all these problem sets that were just horrendous. This was back in the 80s and early 90s where there wasn't an internet that I had access to, if I wanted to understand these problems, I would literally have to go to a library and look up.
What's that?
Yeah, a library, like a big building that had tons of different books and journals, and
Mm.
actually go through them and understand that there's so much basic information that had been ignored or suppressed, in understanding that there are many versions of history, there's many versions of information, but to always keep an open mind, and because of the stakes are so high.
Yeah, and I feel like, speaking of open mind, like kind of like mold, like if you don't know, I have this background in mold assessment and looking in buildings for mold, and then kind of tying it to people that are sick. And now I'm doing the mold lawyer. I'm an attorney now. But mold is kind of one of those things where people still don't really believe it. Like, they don't have an open mind, or they don't have any reason to believe it because they haven't seen it, really happen to them. But is Alzheimer's, you focus on preventing and reversing. Is it very much one of those things where people are like, that's nuts?
It is, and it's unfortunate, and there's a huge parallel with mold.
Mhm.
In both areas, once someone looks at the evidence, it's like, oh, this is obvious, but there's a huge dichotomy there, and I would say, as an example with Alzheimer's, you're dealing with between 30 and 200 root causes for each case, and each case has a different percentage of all these root causes. So for that reason, you're not going to find one single drug, most likely, that's going to fix 200 different problems. And
Right.
for that reason, it's complex, and our current systems, whether it's pharmaceutical companies, et cetera, are designed to look for one simple solution. And it's great when we find one thing that can help. But often when we're dealing with a super complex system, you need a systems approach. And that's true not just of Alzheimer's, it's also true of mold. I
Mhm.
saw, working in a mold clinic for 6 or 7 years, the same thing, where, guess what? In the militaries throughout the world, mold is viewed as a biological weapon. It's extremely well studied, but these same molds, if they happen to be in your office or at home, can wreak havoc on your tissues, your gut, your brain, and other tissues, your liver, kidneys, depending on the type of mold. But thinking back to the training I received, I think the limited training I received on mold was actually in toxicology, which is part of my emergency medicine training, and it was important, but it wasn't the core information. I remember looking back decades ago of seeing some patients during my training who showed up to the emergency room with brain fog and GI distress. I know now, having taken care of thousands of patients like that, they likely had not just mold toxicity, they probably had Lyme and parasites and other issues. And I remember them sharing with me that they had literally been to a dozen different physicians and no one could figure out what was going on. And guess what? In the emergency room, our job is to make sure there's no emergency and then
Mhm.
move on. But I saw that, even though that was the original intent of emergency medicine, that in the real world, often people with chronic conditions that don't have answers will show up in desperation, maybe on a Sunday at 2 in the morning, and just say, look, I've been everywhere, maybe you can help me. So, and that's how I was attracted to this mold clinic in Tampa, Florida, about 10 years ago, where I was able to use my 2 degrees in biochemistry and my intuitive approach, but also my training with in all these different areas. I was able to use that approach to help people fix the problems that they had with mold and other infections.
Yeah, it's such an interesting and complex thing. Like, people don't realize, when you say root cause, like, people are looking for what caused it, but there could be 50 to 300 things, and eliminating 5 or 10 of them could still be helpful, right?
100%. And what's challenging specifically with mold is that mold can hide in what's called biofilm, this biologic film that can hide in your brain and other tissues. I mean, we all have biofilm in our mouth, which is why we brush our teeth,
Mhm.
hopefully a couple times a day.
Mhm.
But that biofilm can travel in other places too. And again, I remember learning about biofilm in medical school decades ago, but it's unfortunately not something that's focused on in everyday clinical life. Yeah.
Yeah, and I've seen firsthand, like I was a mold assessor, still am, for about 5 years now, and I've seen like the doctors have a hard time helping people heal because there's still mold in the house. And like one thing I've seen is like in Florida, every house has mold, and like some people get mad when I say that, and it doesn't mean there's mold everywhere in your house, but every house typically, like if you look at the AC and the ductwork, and you're looking for moisture. So anywhere with moisture in Florida is like kind of everywhere. And we can eliminate, maybe fixing the mold won't get rid of the Alzheimer's, but it will potentially like reduce the burden, right? The toxic burden.
100%. And I remember going back to my training, presenting a patient to one of my attendings, again, decades ago, this was a patient in her 40s. Every time she went to her office, it happened to be in Boston. Every time she went to her office, she would get brain fog and not feel well. And then when she was away from her office at home or elsewhere, her brain would start working again. And it wasn't just her; it was all her coworkers in this one room in an office building. And I remember presenting this case to my attending, and they said, "Josh," I said, "I think this is sick building syndrome," and they said, "Josh, I've never heard of that. What is that?" And of course, I was a nerd still reading, trying to learn all this information. It's a diagnosis I had seen. And they said, "Well, I don't think that's real," because they said that because they had never studied it. So,
Right.
I think it's very important to have an open mind, whether you're a patient or a physician or wherever you are in society, because life is super complex, and to just basically close down and say, "Well, I've never heard of it, therefore it doesn't exist." Sorry, that's not the real world.
Yeah. And open-mindedness is so important. And in Alzheimer's, it's kind of like the closing of the mind almost, right? So you have to help the family be open-minded, but sometimes you also have to work with the actual patient who's kind of losing it a little. So how do you navigate that with people who are losing their mind in some ways?
I think compassion, and then there's some real world hacks that I use. So for example, if I'm working with someone with dementia or brain fog, I'll try to make sure that they have a friend or family member with an intact brain with them. That's number one. Number two, I'll ask them to record. I'll record the conversation myself, because it really makes no sense to have this conversation today and then literally have the exact same conversation tomorrow and every other day.
Yeah, so showing people videos of themselves, does that get uncomfortable for them when they're like seeing the video and they're like, I don't remember this?
It is, but the flip side is I think it can actually help them relearn. You're basically trying to reestablish these brain pathways.
It's so interesting. And is Alzheimer's and dementia are completely different things?
So they're close. So it
Mhm.
turns out that dementia is an umbrella term, and Alzheimer's is one type of dementia.
Mm.
There are many other types of dementia. You can get dementia, poor brain function from a stroke, from a tumor, from Lewy body dementia. Certain half of patients with Parkinson's get dementia. There are many different types of dementia. I often use the term Alzheimer's and dementia interchangeably, because if you look at the United States, 70% of adults with dementia, it turns out it's from Alzheimer's. So it's not the same thing, but with the general public, I often use the terms interchangeably because that's the term they understand.
Gotcha. And so I've seen so many things about Alzheimer's. I know there's like the type 3 diabetes thing, right? Like the insulin resistance in the brain. And then I've seen like there's plaque buildup or there's neuroinflammation. So is Alzheimer's one thing that you can say it's this and a lot of things cause it? Or is there different kinds?
So what I would say is, because when we analyze patients with Alzheimer's, they have between 30 and 200 root causes. I would say it's a complicated process. Not all cases of Alzheimer's are the same. Most of them have elevated amyloid and tau in the brain. Most of the cases, there's a high component of inflammation, but not everyone and not with the same degree. So I would say it's a complicated disease with different subtypes. But again, as a first approximation to start the conversation, it makes sense to use the term.
Yeah, and I hear a lot about the amyloid. That's like a plaque. Is this something that's actually building up in your brain? Like, where does that come from, and how does someone get rid of that?
Yeah, so actually it is a type of plaque. It's a misfolded protein, but actually what we now know is that amyloid is your body's response when it's trying to heal damage in the brain. So it's not the primary cause. It's basically your body's reaction to it. And what we've also found is if you try to remove the amyloid too quickly, there are a couple FDA approved drugs that do that, which antibodies against amyloid. A third of the patients will get brain bleeds and brain swelling, which are not good. And I think that's because those drugs too quickly try to remove this amyloid. Another interesting fact is amyloid also has antibiotic activity. So trying to remove, let's say the amyloid's actually helping to remove infections in the brain, by getting rid of that, that's not necessarily a good thing.
Yeah, it's kind of one of those, we're treating the symptom instead of the root cause.
Right, and we're not being cognizant of the fact that that is a much more difficult issue and more complicated than we would like it to be. Because I remember going to a lecture over 10 years ago at Harvard Med School where, they said, hey, we've got it figured out. Amyloid's a solution. We'll just develop drugs against amyloid, stop the amyloid, and the problem will be solved. It's turned out to be more complicated than that.
Definitely.
But I also say that I am offering for my patients in some of my clinics a different FDA-approved drug, but this one for compassionate use that actually decreases inflammation in the brain and stops and more slowly, we more slowly see the amyloid go away. But after just one dose of this intravenous medicine against inflammation, often I'm seeing improvement, not complete improvement of the Alzheimer's, but definitely improvement.
Interesting. And so are you still seeing a lot of doctors, mainstream, or would you say you're not really a mainstream doctor? Because I know there's the holistic approach.
Right.
Have you kind of moved away from, or it's like a balancing act?
I would call myself an integrative lifestyle. I'm board certified in lifestyle medicine. I'm also board certified in emergency medicine. So I'm double board certified. I would say I would call myself a physician who tries to fix complex problems with the brain using every tool I can get my hands on, including lifestyle, making sure people's sleep is improved, that their stress is lower, that they're exercising, that they're avoiding foods that increase inflammation. And then I'm not opposed to the word holistic, but to my mind, I want to use every tool available out there to help my patients because we're dealing with something super complex. And frankly, we're also dealing with new problems that our ancestors weren't evolved to deal with. So for example, mold, sure, did mold exist thousands or millions of years ago? Of course it did. But the difference is our ancestors were not living in buildings that were airtight that promoted the growth of mold, and they were not, they were not in buildings with drywall, which is a great medium for mold to grow. So for all those reasons, and there are all these additional toxins, man-made toxins, the PCBs, forever chemicals, et cetera, that again are brand new for us. So for that reason, I recommend using every tool available and not just out of hand just saying, oh, because this isn't a drug, therefore it's not worth considering. No, that's silliness. But that has been the approach I've seen from many traditionally trained physicians here in the United States is unless it's an FDA-approved drug or therapy or operation, I don't really want to talk about it.
Yeah. And it seems to me like lifestyle might be like one of the biggest, if not the biggest factors. Like if you count the food, the exercise, and then you've got your environment, right? Is your house moldy? Is it clean? Is that what you find like more than medicine? It's really more of a lifestyle thing?
Sure, I would say lifestyle first.
Mhm.
But having said that, um, I wouldn't take anything off the table. So, for example, we know from our studies that the biggest way to prevent Alzheimer's is to make sure people are getting enough deep sleep. We call it the N3 deep sleep, non-REM sleep. That's the biggest thing you can do to prevent it, but it's not the only thing. And yeah, it's exciting now that we can actually tease apart. But we've got researchers like Dean Ornish, who's shown that in 20 weeks, he's using lifestyle, he's able to reverse Alzheimer's. And so I've been taking that information and basically helping people prevent and reverse Alzheimer's and other um, brain disorders. But I would say it all goes back to an early mindset of, frankly, just be skeptical of everything you hear and read, even if it's coming from yourself, right? Because we all have a unique journey through the academic system, through everything. And you also have to consider ulterior motives, right? I mean, I've got nothing against pharma, and I love using medications with my patients when it's appropriate, but I also have to weigh the risks and the benefits. And I don't find as many, if physicians are skeptical of it, they feel often they feel suppressed, and that people are going to come after them if they're transparent with patients. So there's this, I know you're an attorney, but
Yeah.
if people are worried that, hey, I might get sued if I talk about this, then there's a lack of transparency, which normally isn't good.
Yeah, it's like if you've been treating Alzheimer's for 40 years and then you just found out, oh, it's reversible, like people are like, well, I can't just say that now.
Right, right. So I was taught in medical school and training over 30 years ago that literally Alzheimer's was diagnosed on autopsy. After you die, that you take the brain tissue and you look at it under a microscope and say, oh yeah, that was Alzheimer's, and that really there was nothing you could do. But the exciting thing is people move on. I mean, the information moves on. I haven't found many other physicians, medical doctors doing what I'm doing, and many are afraid to even say what I'm sharing with you publicly. Whereas what I'm doing is I'm going to conferences. I'll go to a conference, for example. I just got back from a conference a couple weeks ago, and literally I learned about 80 new treatments coming down the pike. And then I have to decide, well, which of these 80 treatments do I offer to my patients, and I'll basically pick one from each category of the best of the best. And that's why I think I'm seeing good results is I'm layering all these solutions together in the right order. And that's key, both with treating mold and with treating Alzheimer's. You have to get rid of the toxins first. If you don't, patients can easily get worse. And that's another mindset that I agree with that I was taught in medical school. First thing, don't do any harm. And if you just it makes me angry that there are certain treatments out there, both for Alzheimer's and for mold. And if you do these first, if you start killing mold without detoxifying, you can easily make people worse, because when mold spores die, if you kill them with whatever essential oil, or antifungal, if you kill the mold spores, they will release all the toxins inside of them if they're part of biofilm, and easily patients can get worse.
It's such a fascinating thing. And so you talk about reversing, and that's different from curing, right? I mean, this takes 20 weeks of hard work. It's not just push a button and you're cured. Um, so prevention is completely different from reversing.
Right, and prevention I think is easier, right? I mean, if you catch something early, it's a much easier thing to do, and likewise, it's a lot easier to reverse mild early Alzheimer's or dementia compared to moderate or late stage.
Right. But is there kind of permanent damage from Alzheimer's, or is it in a lot of ways like mostly reversible?
That's more of a philosophical question
Mm,
because you can say, oh, it's permanent damage. But the cool thing is, once you reverse the biologic age of the brain, you can retrain the brain. And just like when you're trying to educate a little kid, get their brain going initially, the secret is human interaction. Just like you don't want to raise your 2-year-old by having them watch TV screen all day, if you have a 75-year-old with moderate Alzheimer's that you're working on reversing, the last thing you want to do is sit them in front of a movie screen or a television screen all day. They need human interaction. It's human interaction where you can retrain the brain. And what's exciting is many of my patients with Alzheimer's, their memory for things that happened as a kid is still there. It's just what happened today or the last year that might be gone. And no, I'm not claiming that I can miraculously bring that memory back. What I am saying is these techniques can help regenerate the brain, and then you can retrain the brain and fill that in.
yeah, it's interesting. And I don't think people understand that you can actually, when we talk about rewiring your brain, like we're actually building neurons and pathways. Like we're literally forming a new brain almost.
Right, but I also want people to understand how complex we're talking about. We're talking about billions of neurons in the brain and then trillions of synapses or connections
Mm.
between those neurons. So this is super complex, just like some of these new LLM, artificial intelligence, super complex, huge amounts of memory. Just like we don't understand exactly how consciousness and memory actually works in the brain, we don't really understand, at least I don't, uh, how some of these LLMs or AIs appear intelligence. We say, oh, it's because they're predicting what's the next step. Yes, but I also think there's something going on when you give, whether it's the brain or a computer, you give them access to huge amounts of computing power. There's something that's happening there that I don't think we understand yet. I know I don't.
Yeah, it's super interesting. And we were talking a little bit about, the younger kids, how they learn. And a lot of people say you can't teach an old dog new tricks, which I think holds a lot of people back. And it's an excuse in a lot of ways. But I have a grandma who's 95 now. And I don't think she's dealt with Alzheimer's, but in her 80s, like she was physically and mentally like coming to the end kind of. And we ended up getting her into physical therapy. And now in her 90s, like she's amazing. So do you see a lot of that where, older people, 75 plus are turning their whole brain and life around?
100%. I'm seeing seniors do this every day. And that's why when I hear firsthand or secondhand where a doctor or someone says, oh, you're just getting old, don't just live with that. That to me, that's an old attitude. The new
Mm.
attitude is it doesn't matter what your chronological age is. The key is we can optimize and we can make it better.
Yeah, and this new thing with like turning back your clock or reducing your biological age, like you could have a 90-year-old who's getting younger. And like this idea of getting older, like I see 90-year-olds doing push-ups and pull-ups and like even my grandma standing up and down and walking without a wheelchair. And like in her 80s, that would have never been possible. But even like you said, the human connection and the physical movement, and we have her in a place where there's bingo and things like that help. And I saw a TED Talk that said that the number one correlated factor with living a longer life is human connections. Like the more you have, the better.
I agree. Human connection is a key part of lifestyle. We are designed as humans to be part of a tribe, to have friends and family, maybe a couple hundred people around us. We're not designed to be loners by ourselves. And it's kind of ironic. I remember part of my medical training was just trained to, you're by yourself at 2 a.m, figure it out yourself. And that was actually very helpful when I was by myself in hospitals trying to fix problems. But no, as humans, we are designed to be part of a community. And that's why I'm not a fan of drinking or smoking. Those are both toxic to the brain. But if you need to do that in order to socialize, I don't know, maybe socialization is more important.
Yeah, it's interesting. I mean, obviously, don't get hammered and then drive your car, but it's definitely we're not solitary creatures, and it's an interesting thing. So you talked about sleep like being very important, and that's for prevention and reversing. Just
True.
overall, we need sleep, right? Are there other things that are, I mean, lifestyle, so diet. So what are some things like diet-wise, for example, that people are doing wrong?
Sure. So if you look at, for example, the average American, they're eating a diet that's highly processed, meaning not a lot of whole plants, and there's a lot of added salt, oil, and sugar. And we know that those things in high amounts lead to damage of blood vessels, and they also speed up aging. So the key, in my opinion, is you want to eat lots of fruits and vegetables and whole grains and avoid as much as possible the processed foods. The problem is many people are going out to eat, and what foods are on offer? Those they're eating they're getting their food from supermarkets, and 90% of the things there are highly processed. So you
Mhm.
actually have to be, even though food is super available in our society, you actually have to be very picky about what it is that you're putting in your mouth.
And I know you said plant-based. Is that more diet-wise or medicine? Like, are you anti-meat?
Yeah, I mean, I think that unfortunately meat, if you eat higher up on the food chain, you're gonna have much higher levels of toxins.
Mm.
So from a health perspective, I recommend people eat plants and try to avoid meat and fish. Yeah, so that I think that's important.
But it might make sense, like a grass-fed beef might be better than a garbage-fed beef. Or
Um,
you wouldn't recommend beef?
I wouldn't, because, for example, I've seen studies that even the organic grass-raised beef might have higher levels of toxins than the conventionally produced beef. It could be because they're letting those cows live longer, and toxins concentrate at the top of the food chain, but they also concentrate over time. So if you let a cow live longer, it has a longer time to accumulate plastics. I mean, this is really scary. The amount of plastic in our environment and in food chains doubles every 14 years. And we've been producing plastics for almost 100 years now. And this is scary to me, because I'm looking in my patients at how many toxins they have, and then also so both the number of different ones and then the levels, and I'm seeing both double in the last 10 years. So, and to me, part of that is change what you eat, because they've done studies where you compare the vegans who aren't eating the beef to the beef eaters, and the vegans have an order of magnitude less. They might have 10% of the toxin level that the meat eaters have. So for those reasons, I recommend that people try to stay away from animal products.
And I'm sure we could talk about meat versus plants for a whole episode, but
Sure.
I have seen, like, are plants producing defensive toxins in general?
Sure. And what's fascinating about this is one of the reasons why plants are protective is they produce antioxidants.
Mm.
And those antioxidants, the purpose of those antioxidants in the plants world is to keep insects and basically control pests. But we actually benefit when we eat those plants.
Yeah. And so sleep, diet, exercise, right? That's lifestyle. So do you recommend people are working out every day?
I do. But I don't try to overwhelm people. So, for example, you take someone who's doing no exercise. No, I don't want them exercising, going from 0 to 3 hours a day overnight. And yes, it is possible to overdo it. I don't think we're designed as humans to run marathons every day. Having said that, when you exercise, you actually release an important growth factor in the brain called BDNF, brain-derived neurotrophic growth factor, that stimulates the growth of neurons and synaptic connections.
Mm.
So, yes, for my patients, I want them exercising every day and then more than they have been in general, but I want them to do it slowly and in a safe environment. I don't want them to uncontrollably run and fall and trip and break their hip, and now they have a 50% chance of mortality because they can't get out of bed and they're going to get a pneumonia or infection like that.
Yeah, definitely don't want people to get hurt as part of the treatment.
But it's this ancient Greek term called hormesis. What doesn't kill us makes us stronger. As humans, we are not designed to stay in bed all day and do nothing. We are actually, and we're not designed to look at a screen all day, although I love that people are listening to us right now. But we are designed to be active, and another thing that is helpful is hot sauna or cold plunging. It's the contrast between the two that helps rejuvenate our cells.
Yeah, a lot of trending topics with all that stuff. And when you talk about exercise, like I've seen things that say that strength training is the most important thing versus cardio. Is that true, or is it kind of a mix?
I mean, I would agree with that, but I think both are very important, right? You need cardio, you need a strong pump from the heart to get blood to the brain and other tissues. You need strong muscles for sake of longevity. But the other important thing is balance, right? I mean, I don't want people tripping and falling and breaking bones. So to me, balance is important too. And so it's hard for me to say, oh, there's one most important. No, all three of those are very important. But I don't want people to be overwhelmed and say, oh, because I can't do all these things, I'm going to do nothing. No, start where you are and get a little bit better. And you know what? Do it in a group, because then you're checking off the box, hey, I'm part of a community. I think it's a lot more fun to work out with someone else.
Yeah, and you can involve a trainer, and maybe someone prevents you from falling over, breaking a hip. But it's super interesting. And so I'm fascinated by like kind of the business side of it too.
Okay.
Because obviously Harvard, MIT, and now you have, was it a handful of clinics or multiple?
Correct. I'm involved with different clinics, different entities, and people I'm working with.
And would you attribute that to those long nights that that mindset of put in the long nights? Like what drives you to do all that?
So right now, a few things drive me. One is I understand from working in this mold clinic for many, many years, and then looking around and being a medical doctor focused on preventing and reversing Alzheimer's, there are very few other medical doctors with the training that I have and can share this with the general public. So I would say my biggest driver is to share with as many people as possible the fact that there's hope. So even though Alzheimer's and dementia has been labeled, there's not a lot you can do, get your affairs in order. No, there totally is hope. I'm reversing this every day. And to me, that vision and spreading the message all around the world is the most exciting thing. Now, yes, I'm in the process of setting up clinics. I do one-on-one coaching with people around the world. I love the fact I'm doing podcasts with people like you, and I love all that. And yes, do I make money through these clinics? Yes, I do. But to my mind, if there's no profit, there's no mission, there's no I'm putting the money back into the business to reinvest and to spread the message.
Yeah, I'm guessing money wasn't the first motivator. I mean, you already said it was a family, but the money follows, right? When you put those hours in and 2 a.m. studying, and you're only 17 years old, but the money follows when you pursue your passion.
True, but I mean, yeah, if you're just looking at it from an investment standpoint, yeah, I mean, to put that time and energy in when you're 17 or going through over 10 years of medical training, yeah, if people out there just want to make money, I'd say go to Wall Street. But yeah, to my mind, the money that's flowing back is just, it's a report card that I'm helping all these people. So to me, it just means, hey, I see I'm helping a lot of people, and they're spending some money on something that's really important.
Yeah, interesting. And I like the concept of, putting that money back into the business, which is obviously a good business play, is like, don't go to the Bahamas and blow it all.
Yes.
Um, and I know you're kind of mentoring your clients, right? Like the families and the client themselves, the patient, and giving them hope, I feel like is a really big part of that, right?
Definitely. I feel like sometimes I'm a social worker, and both with mold and with dementia, oftentimes the family will be split. Half the family will be supportive, and I hate to say it, but the other half will either be like, "No, don't spend grandpa's inheritance on him. Spend it on, save it for me," or, um, you know, this is all in their head, or like with mold and teenagers, oh, they're not thinking clearly. They're just lazy. They don't want to get out of bed. They're making up this brain fog. No, it's real. I have objective proof of huge levels of mycotoxin, mold toxin levels. I have objective proof, but unfortunately, the typical story is, oh, a family member will talk to their doctor, and their doctor says, "Oh, mold illness doesn't exist, therefore they're making it up."
Yeah, I hear it all the time, and I feel like people want it to be so black and white. Like, this is mold illness, which means this caused this, or as opposed to where there's, like you said, there's 50 to 300 root causes, right? You could have 50 different kinds of mold in your home. So 50 of those root causes might be different kinds of mold.
Right, right, and not all mold is toxic, but certain ones like the black mold trichothecene are devastating.
Yeah. And I like to talk about, obviously I have a background in mold assessment, and we talk about, are they toxic or not? But even the ones that aren't producing mycotoxins, in my opinion, they're still producing spores. They're still producing fungal fragments. So when these things get through your lungs and your brain barrier, like, this causes toxic effects. So I always say, like, every mold is harmful. I mean, they're decomposers. It's indicating a moisture issue. And then we get people they're looking for that black mold, which Stachybotrys is a black mold, Chartarum, but there's also Aspergillus niger, and there's a lot of black molds.
Of course.
But if you have, one sort of mold on this side of the wall, what's on the back of the wall? So I usually encourage people, don't look for the type of mold. Like, let's figure out why you have mold and what issue is causing it, similar to the body. But it's, I've felt that kind of social worker, or like I'm a therapist sometimes, because I've dealt with the same exact things with mold. I'm kind of like a doctor at sometimes, which I'm not. But like, I've had to talk with, the husband who's a non-believer, or people are getting a divorce, or the kid is getting sent to boot camp. And there's so many family things and the financial side is really big. But I find myself, that's kind of where I got into the mentorship, is like, I'm leading these people through fear and anxiety, and they're hopeless. A lot of them, I can't afford to do this or this, so I'm just going to give up. But there's levels for every budget. It's an interesting correlation. And so, have you had mentors, or were you always hit the books and solo?
No, I was lucky. I definitely had mentors. I sought them out. I remember Harvard undergraduate. I had a Dr. Peckett who basically coached me through basic biochemistry and explained how he had developed commercially steroids, different types of steroids, and helped me understand how these basic biochemical pathways are so important for different parts of medicine. And actually, he coached me for 3 years. Now I think about it. Yeah.
Wow.
Yeah. It was once a week for 3 years. So that I got his scientific, and I think some of his business skills too, and how to interact with people and just be kind. When you don't know something, just be kind. And then, so that was at the beginning of my career. I say most recently, the mold clinic in Tampa, Florida was via Dr. Rick Spinagle. He basically taught me what he had learned. And Dr. Spinagle, brilliant mind. And so I could understand what he was doing with my 2 degrees in biochemistry, but he was willing to share with me how mold affects the human body. So even though much of his practice isn't published anywhere, he was generous in sharing with me. Unfortunately, the Spinagle Clinic is no longer present in Tampa, but that's a year and a half ago. That's why I decided to move from Tampa here to South Florida, West Palm Beach area. Specifically, I thought there was more opportunity here, and I've been right. And I'm sure we'll go back and open up clinics in Tampa. But no, Dr. Spinagle was, we had up to 80 patients at a time, and literally we would daily IV therapy to get rid of some of these mold toxins. And yeah, some patients would be with us for up to a year until we figured out some important regenerative approaches with things like IV exosomes. So the fact that he was able to share with me techniques that you couldn't find anywhere else, not published anywhere else. He told me that he was afraid to publish because people had stolen his work in the past, and I can respect that. And yeah, so I feel like I stand on the shoulder of giants who've taught me what I know today. And again, a lot of it is giving back. And because, I was working in emergency rooms for around the country in 14 states for over 20 years. But I looked around one day and I was like, I'm the oldest person here, and I could still work night shifts, even though I knew they weren't healthy for me. But I thought, wait a second, they're putting out new interns and new residents and new emergency physicians, but they aren't putting out a lot of new physicians who are experts in fixing mold and brain fog and brain disorders with 2 degrees in biochemistry. This is what I'm going to focus on. And then I did an online summit with 30,000 views from people around the world. And then I got the bug. I was like, no, I need to help as many people as possible. Number one, tell them that there's hope. And number two, if I can work with people one-on-one, show them, and then to scale, to open up as many clinics as possible, because this isn't just a problem in Florida, even though, yes, there's definitely a ton of mold here, but this is an issue all around the world that we need to share.
Yeah, it is. And people think it's just the humid places like Florida. It's definitely not. These harsh winters up north cause damage to homes, and there's tons of mold. And It's very common up north.
Right.
And one thing, I've always told doctors they should recommend HEPA air purifiers, HEPA vacuuming, dehumidifiers. Do you do anything like that?
Yeah, I like all of those things.
Mhm.
But again, humility, because I've seen some extremely wealthy people with huge houses, and it turned out the mold was hidden in tile in their bathroom. It was behind the tile.
Mm-hmm.
You couldn't tell until you actually tested the air. So it doesn't matter that if you lived in an arid desert, if you are humidifying the air in a shower
Mm-hmm.
and you're not careful, boom, you could definitely get black mold hidden there.
Yeah. And that's an interesting point about the air testing, because that's one of the, when I came into the industry, I was kind of like on the mold testing side. Now I'm on the mold assessment, which is more like a moisture assessment.
Sure.
Which I know you had another pod you shared with me with a big mold guy. And but the air testing can often be very misleading. A lot of times the air test won't show anything, and then you still have mold behind the wall of the tile. So it's kind of a shift now to being able to find moisture issues. That's number one. And even in the desert, you get plumbing leaks and torrential rains once in a while. But I actually feel that I help people heal through reducing their exposure, which is not just finding and remediating the mold, but HEPA filtering the air, or better, but constantly filtering the air, constantly dehumidifying, which is keeping everything dry, which here is very important in Florida, obviously, because even if your humidity is good in your home, then your AC is probably doing all that work. So I find mold in every AC in Florida, which is a whole nother conversation. But if we can eliminate the mold, let's do it. Maybe it won't fix everything. But yeah, the air testing can be misleading, but helpful. And then there's the mold dogs now. Have you heard about the dogs
No,
that
educate me.
they sniff out the mold? Like they would sniff out drugs or cadavers. They're trained on mold now. So it's a really big thing. And as a mold assessor, I would say that it's really not a complete assessment without a mold dog.
But what I would also say is that for patients who have been exposed to mold, often they have a nose for it. They know
Yes.
within a second of going to a hotel room, oh, there's mold here. I can't be here. I need to leave right now. So it doesn't surprise me that you can also train dogs the
Yeah.
same way.
Yeah. And I could smell, I mean, every building you walk in Florida, you're going to,
Right.
most people are used to it. They don't know, oh, I'm smelling mold. Most commonly I hear it smells musty or it smells moist. But what does moist smell like?
Yeah.
If you have moist laundry that's been sitting in the corner for a week, it's probably already got mold growing on it. But the dogs are obviously much more sensitive. And, I think people are missing out. Even if you have a really good mold assessor, I can only smell so much. Or maybe I have a cold, I can't smell anything that day. But I do use my nose as one of my tools. I think a good mold assessor should use all 5 senses. Literally touch, taste, smell, vision, hearing, like it all comes together. So a lot of mold assessors are just in and out. And it's the same for like an attorney or a doctor, right? Like you got to be locked in. And like you said, it starts, I think, with compassion and hope. Like a lot of people, I'll talk to them and they've already had 4 or 5 mold assessors that couldn't find the problem. Kind of like the 4 or 5 doctors you probably went to, or 3 or 4 lawyers you went to, that they're not taking the time to say, okay, there is a solution, there's hope, there's compassion. Someone is listening. A lot of people, maybe the woman or the mother is like, well, nobody's listening. Like, thank you for listening. Such an interesting concept. And do you feel like, are you kind of manifesting anything right now, like differently? Or are you just trying to help as many people, or do you have something big in the works? And how do you manifest something like that?
Yeah. So deep down, there's a huge amount of gratitude that I have. In terms of, I'm working on a book. I'm working on my weekly podcast. So I feel like I'm out there. I'm going to start in a few months, have a meeting for basically a symposium for the general public with mold or dementia issues here in South Florida. So stay tuned for that. So yeah, I feel like I'm on the leading edge of all these different approaches. So yeah, and what's also interesting, we're towards the end of the year, and as we're recording this right now, when I look back over the last year, I mean, huge strides, but I also realize that on any given one day when I'm in the throes of all the busyness, sometimes I lose track of just the impact that we're having.
Yeah, and you kind of get out of the moment a little bit when you want to enjoy the process. But I love how you talk about gratitude, and I love to talk about it because it's not just a great attitude, but it's an actual practice, right? And you talked before we started about brain chemicals, and very knowledgeable about it, of course, but I feel gratitude is like an actual thing that you do where you actually turn on the happy chemicals. Does that sound right?
It does sound right. And, what we talked about right before we recorded was how people with mold, certain mold toxins like the trichothecenes from black mold will specifically inhibit an enzyme called GAD that converts glutamate to GABA. Glutamate is an excitatory neurotransmitter. GABA is a calming one. So what gratitude is the ability to take things in perspective and want to give back. But if you're super anxious, if you have too much electricity in your brain, you're not able to tap into some of those what I would call parasympathetic restoration pathways. That if you're constantly stressed, life is not good, and you if you're stressed, you can't focus on helping others. You're trying to survive. If you're in survival mode, uh, life is not good. Long term.
Yeah. And I don't think people get, like, if you spend 10 minutes being grateful, like, that's 10 minutes where you're not stressed out. You're not mad. You're not angry. Like, that 10 minutes was great, was you had a great attitude. And you're actually, wow, I'm grateful I live in Florida. I'm grateful I have, whatever, nice parents or a nice dog. It's an actual practice of taking time out of your day where you're not building empires and I think starting the day with that, right, is such a good, you want to set your mind. But we were talking about mold rage, which is a process where we see it all the time with mold, where people are like fuming, raging, face red. You see that a lot with the mold exposure?
I do. Yeah, and you're exactly right. If you're in rage, the last thing you're thinking about is giving back to anyone. You're centered on yourself, and I think that's another important perspective or attitude or approach, is that I believe in our society now, people have become much more me focused, and there's nothing wrong with looking after yourself. The problem is when we give up forming close relationships with friends and family and and we don't have an attention span where, if we can't have a conversation for more than 10 seconds, how in the world am I ever going to figure out how you're thinking, or you're going to figure out how I'm thinking? And frankly, that's how strong relationships are founded, is where we're basically getting into each other's brains that way.
Yeah, and I'm sure you've dealt with some moments where things got heated up between you and a family member and a patient or whatnot, and pretty heated up, I would imagine. And how do you navigate that? Is it just, here's the science and stay calm?
So what I do, and I feel like I received decades of training in this, in emergency rooms in some of the most stressful times. And what I learned just by watching some attendings and then real world experiences, if it's super stressful, if I find other people are getting extremely angry, stressed, what I need to do is do the exact opposite. So the more anxious someone is, I try to get calmer and calmer. And so if someone's anxious and is looking for me to answer their question right this second, actually the most effective thing I can do is stop and not answer quickly.
Mhm.
And it's I don't know, maybe it's a technique of stoicism. It's just something that I came across, and it's been effective. And I think part of it is you're asking the other person to mirror you. So if you mirror someone's anxiety with more anxiety, it's just going to ramp things up. If you respond to someone's anxiety with calming down, hopefully they will see that as an approach.
Yeah, and that's super helpful. Like, people thinking kind of before you act and reading someone else's energy and not reciprocating it. So I wanted to talk a little more. I know we've been going for a little bit, but we kind of touched on inhalational Alzheimer's, which is people are inhaling things like mold, which is leading to it. And so there's the type 3 diabetes kind of angle. Is that an official term that we can use, type 3 diabetes?
We can. I don't think it's recognized by insurance carriers, or
Mhm.
I don't think it's part of that term. I don't think it's specifically part of the ICD-10 or whatever DSM system people are using these days. But what I would say is that insulin resistance is definitely one of the risk factors for Alzheimer's, because we know that Alzheimer's or dementia is often a metabolic disease. So if you are not able to process glucose correctly in your brain, then that can lead to dysfunction of your normal brain cells. But I would also say it's not the only cause
Right.
of Alzheimer's. There's so many others, whether other sources of inflammation or trauma or genetics or infections or other toxins.
Right.
There are so many other root causes, but it is an important piece. You want to focus on, you want insulin sensitivity, not insulin resistance.
So do you recommend people, because I know there's people think about sugar, oh, that's candy, but they don't realize that the carbs in the bread is converting into sugar. So, and I've learned this through being type 1 diabetic and, everything I do, even stress up and down with the blood sugar. Do you recommend people are on like a low carb keto sort of?
Yeah, it's interesting. So I would say this whole topic is controversial,
Mm-hmm.
and things that are controversial, I don't think we understand all of it yet. But here's my perspective. I've seen people improve dramatically going on a keto diet in terms of their brain function. But I've also seen people get much better sticking to a high carb, high fruit diet, because a high fruit diet will lead to insulin sensitivity. And
Even with the sugar.
well, let's be clear. The sugar in an apple is different. That your body treats that differently as opposed to if you're just eating highly processed sugar. Because in the apple, you're getting all this fiber. And so you're normally not going to get the same type of sugar spike. Now, everyone's different, and it's complicated, and I'll tell you why it's complicated, because it's not just sugar. It also is fat that determines insulin resistance or sensitivity. It turns out that fat in your diet will gum up the insulin receptors. The name of the receptor is GLUT4, GLUT4. But basically, if you're eating a high-fat diet like most Americans are, the normal insulin response is gummed up. It's called intramyocyte lipids. If you eat enough fat, much of that fat will end up in your fat cells. The lipids will deposit there, and there will also lead to insulin resistance. Whereas if you have someone who they're fruitarian, all they're doing is eating fruit, you will see that they will not have much insulin resistance. They will actually have insulin sensitivity, including type 1 diabetics will need less insulin. And again, all sugar is not the same. When you say sugar or carbohydrates, people think, well, if I eat, if I drink a glass of water with just a bunch, sugar water, that somehow that's the same as eating an apple.
Right.
Normally it's not. And, with these continuous glucose monitors, you can actually see. But the other part of the equation that people are not aware of normally is that fat is also the piece. So the key is, if you have a fruitarian, someone who's just eating fruit without adding lots of fat, that's where you'll see the insulin sensitivity. If you take that same fruitarian and say, eat a lot of nuts with it, then they will have much more insulin resistance.
Interesting.
So this is more complicated than people understand. And so, but to go back to your original question, I think if we're trying to focus on brain health, you want the brain to have metabolic flexibility, meaning it could survive either on a high carb diet or on a ketogenic diet. And I think, and again, I think the research needs to be done on this, but I think what we will find is that, putting a patient on a keto diet for 3 months and then switching to a high carb, low fat diet for 3 months and maybe switching back and forth could be healthy. But I can tell you what is not healthy. It is not healthy to be on a high fat, low carb diet for extended periods of time, for a year or 2 years or 3 years. We know from the studies that if you're on that type of diet, you end up with, it's acid forming. So you end up with damage to your liver and your kidneys. You get bone destruction and other organs in the tissue. So what I would say is everyone is different. So for example, if I have someone with Alzheimer's who's super skinny and I need to put weight on them, Sure, I may have them take oil because it's the most calorie dense food. But if I've got someone who's overweight, the last thing I want to do is have them eat oil that is going to cause them to gain weight. Having said that, I'll put a plug in for omega 3s for patients with Alzheimer's. That Dean Ornish and his studies, and in my own experience, I want patients with Alzheimer's normally to have, say, 3 grams of omega 3s a day. So, yeah, when it comes to metabolism, it's super complicated in terms
Mm.
of you have all these, I remember all these biochemical pathways, and it's even more complicated than that because we do not understand all of the regulation of these different pathways. Sure, we understand some of it. We don't understand all of it. I mean, this molecule leptin was first discovered recently.
Mm.
I bet you there are going to be many more discoveries and exponentially over the next few years involving human metabolism.
Yeah, and it's important to stay on top of the new research. And people don't understand how quickly technology and science, especially with AI, like it's just going so quick. Like your doctor might not have seen the news yet. You got to be on top of it. I know you talked about glutathione first. I think, is that a website, glutathionefirst.com?
Yeah, that's one of my websites,
Yeah.
and I created that because because I find glutathione is so important to do first if you're treating mold or other metabolic toxin type approaches. I said earlier, first do no harm. If you don't have enough glutathione, and I find many of my patients do not, if you start trying to release toxins, you actually can hurt them because the toxins will overwhelm the normal glutathione pathways in our cells.
And is that just, you can take glutathione orally, or it has to be an IV, or?
So someone with mold toxicity or metabolic problems with Alzheimer's, high toxin levels, normally I will start with intravenous in addition to giving orally under the tongue or topically on the skin. And normally they will require high doses of intravenous glutathione, or we will work up to that. And then my patients might use a spray or the topical as a rescue if they run into mold in their normal environment. But no, I think glutathione is very important, and
Mhm.
it's not normally recognized. It's 3 amino acids stuck together, but it is critical, I think, in an approach to detoxification.
And one last kind of medical sort of question. So I know like a lot of these older generations are on statins and reducing cholesterol, but I've heard that cholesterol is actually super important, right? So is there any correlation with that, like the statins and the Alzheimer's?
Yeah, so again, it's complicated. So it's interesting. If you look at statins in general, in some people have different genetics.
Hmm.
Statins were actually developed for the rare 1 in 300 people that have what's called hypercholesterolemia. And then they said, well, if it works for people whose cholesterols are 500, why don't we use it on people whose cholesterols are 250? Um, but it turns out that, I mean, there are studies showing that statins can lower inflammation in some patients, but actually it can make things worse because the way statins work is they damage mitochondria. So to my mind, it's a dirty drug. It hurts mitochondria. Mitochondria are present in almost every cell in the body, producing energy and removing toxins. If you destroy or hurt a system that removes toxins, your toxins can build up. And I've had many patients where they develop brain fog after starting on statins. And to my mind, there are many other ways to lower your cholesterol besides statins that are much safer. For that reason, I don't recommend statins. But the party line, if you go to a cardiologist, they'll be like, "Well, let's start you with statins." Now, many cardiologists know that there are other options. But for my patients, I try to get them off of statins, and if their cholesterol is still high, find other approaches to bring down their cholesterol levels. One approach is simply getting them to eat more fruits and vegetables and cut out animal products. There's zero cholesterol in plants, but if you're eating animal products, you're getting an extra dose of cholesterol because our bodies make enough cholesterol normally. And I think your original question is, do you basically need cholesterol for the brain? And yeah, I mean, cholesterol is a normal part of our body, but we don't need extra in our food supply. So, and people are like, oh, but you need healthy fats. It turns out that in the typical American diet, all those excess fats are leading to blockages in their carotid and other arteries and blood vessels in the brain. So to my mind, you don't need animal products for cholesterol or basically anything else.
Fascinating. You're definitely like the go-to guy for this complicated medical brain stuff. So I like to leave people, we're getting towards the end with, I like to have the guests kind of leave a mentorship mantra. And I kind of want to angle it maybe towards the people who are like 17. And to me, it's important for the people that don't have a passion. Like you had a passion because you had the family thing. But I feel like a lot of people don't know their passion. And do you have a good mentorship kind of mantra for them?
Sure. So a couple things. Number one is I find that people who are optimistic about the future end up living longer. And I remember being 17 and super optimistic about the future. And guess what? I'm 59 now, and I'm just as optimistic. So I think a lot of it is about mindset and personal responsibility, because you are going to hear a lot of advice from your parents, from your teachers, from your friends, and your family. But the key point is to understand that if you look at how amazing the human brain is, it's the best computer, it's the strongest computer we've ever found. But you have to trust it. But you also have to understand that you will be wrong. I remember going back to medical school and being told, they go, half of what we're teaching is wrong. So, but being willing to be flexible and pivot and understand that there can be many different approaches and opinions, and to basically keep an open mind and understand that if you have a long-term goal, you can get there. We live in a society now that is changing much faster than decades ago when I was growing up. But the cool thing is, understand when people are describing the changes, that focus on your long-term goals and try not to be swept up with some of the passion. Understand that there are business cycles that have continued even as technology has advanced, and try to have a picture 10, 20, 30 years out. Don't always be focused on the headline in social media or in the news. And it's self-confidence. And you can actually get that through exercise and some of the lifestyle things we talked about at the beginning.
Mm-hmm.
Get enough. If you're having troubles, get enough sleep on it. Don't make a decision when you're sleep deprived.
Yeah, definitely. And personal responsibility, like take accountability for, you can do this thing and take accountability for it. And I think a lot of people don't hold themselves accountable. Like you say you're going to do something and then you don't do it. Are you punishing yourself? Are you reflecting on it? Because if you don't, eventually it'll just build up and then you'll just be shameful one day. And do you find
but also the concept of self-compassion.
right?
You will definitely make mistakes. We all do. The key is, what happens when you make a mistake? Can you try to learn from it? And don't beat yourself up about it. Just as I find people who are really tough on themselves are often tough with people around them. And what I would say is, just like I want you to be nice to other people, be nice to yourself.
Yeah, that's a really big, really important thing. Like reward yourself, but also punish yourself if you need, like, parent yourself. And do you find a lot of this carries over into the business side of it? like having multiple clinics and things like that?
I do. And just to share with you, one thing that's, I think, very important for people when they're 17, some of you at that age are genetically or through mold will have low levels of dopamine, and you will actually try to do things to increase your dopamine. A common thing is for teenagers is to take substances, whether it's alcohol or illicit drugs like heroin or smoking nicotine. Sure, you can do all those things to raise dopamine. I would suggest you do healthier things like exercise or gambling will also raise dopamine. But I would argue I don't like to take gambles where the odds aren't in my favor. So sure, take risk, but analyze the risk and the return. If your expected return is negative, probably you don't want to take that risk.
Yeah, like betting on yourself, that's a good gamble. I've seen gambling destroy families, and obviously don't go to the casino and get hooked.
Right.
But there's things healthier than harming yourself with substances. And I would say if it feels good, it's probably not that good for you long term. Like you said, think long term.
Right. But I would say let's have some nuance there, right? Because all these things that give you a reward will give you dopamine. Some of those things are actually good for you, and some of them are harmful. So the good ones are exercise, taking a risk and delivering an amazing result. Sex has its place in our society, but yeah, they're definitely society has things where there's alcohol, tobacco, illicit drugs, legalized gambling that is designed to be addictive is not good for you.
Yeah, super fascinating. And if you're not making mistakes, you're either perfect or you're not doing enough.
Yeah.
It's good to push your boundaries.
100%. I'm aware of no successful businessmen who never made mistakes. Mistakes are the way you learn. Hopefully you fail early and often so that you can get that out of the way and build a successful business.
And it's okay to make a mistake. And I think maybe a lot of the way we're raised is like, you made a mistake, you're in trouble, you're in timeout. So I think people are scared to make mistakes, but it's actually perfectly normal and okay. And that's part of the learning process.
Right. But if you go back to the way school was for me, and I'm sure not much has changed, we're not normally we're getting graded on our own performance. We're not graded on how we interact with other people. But guess what? In the real world, you're normally not graded on how you do yourself. It's like you and your team. How is your business team doing? If they're successful, your whole business is successful. So I'd say one of the most important tools is collaboration. And I learned some of that in school, but often a lot of the schooling that I went through was, you can't afford to make a mistake. And yeah, that's, obviously you don't want to make a mistake with someone's life on the line. But the flip side is transparency, so that you can learn and other people can learn too.
And save some money up so you can afford to make a mistake, right? Some people have no money, then you have to make a good call. If you have a little money saved up, then you can literally afford a mistake, which is so important.
It's true. You want to often you want to consider what's the worst case scenario, and if you have a moat, if you have a rainy day fund, it's a lot. You can take more risk without worrying.
Yeah, I say prepare for the worst, but expect the best. Be optimistic, but be prepared for something bad.
Right.
But I feel like we could talk for days.
True.
But Dr. Josh, I really appreciate you joining me. Thank you. I think it's really going to help a lot of people open their minds.
Yeah, Jonathan, no, it was great meeting you in person and being on your podcast. Yeah, there is hope.
Yeah, there is.
Yeah.
I say with my business, healing is possible.
Definitely.
Which I don't know if I stole that from someone, but it's true. There's always room.
I
Thank you again.
Yep. Peace and plants.